Hi class. For this week 12 discussion, I'm going to be going over Tommy John surgery. This is a procedure that helps repair the elbow, especially for athletes who throw a lot like baseball pitchers. So first, to understand the surgery, we're going to look at how the elbow works. The elbow is a hinge joint made up of 3 bones, the humerus in your upper arm and the radius and ulna in your forearm. These bones let you bend, straighten, and rotate your arm in different directions. On the inside of your elbow, there's a really important ligament called the ulnar collateral ligament, or most commonly known as the UCL. This ligament helps keep the inside of your elbow stable when you're throwing. For athletes, especially pitchers, the UCL takes a lot of stress every time they throw the ball at high speeds. Over time, this constant stress can stretch or tear the ligament, which causes pain, weakness, and difficulty throwing. That's when doctors may recommend Tommy John surgery. This surgery was famously named after a baseball player named Tommy John. He was the first person to have this procedure done back in 1974. The goal of the surgery is to replace the torn UCL with a healthy tendon from somewhere else in the body. Usually, the surgeon takes a tendon from the forearm called the palmaris longus tendon. About 85% of people have this tendon, but around 15% don't. If a person doesn't have it, doctors can use another tendon like the plantaris instead. During the surgery, the doctor drills small holes in the arm bones and threads the new tendon through in a figure-8 type of pattern. This helps secure it and allows to act like the original ligament. Over time, the new tendon adapts and strengthens the elbow. Recovery from Tommy John, although, does take a while. Usually from around 12 to 18 months before an athlete can return to full activity. Most people make a full recovery and return to their sport just as strong, or even cases just as stronger than before. So to summarize, Tommy John surgery gives athletes a second chance after what could be a career-ending injury, especially for pitchers who put so much stress on their arm when throwing a ball at high speeds. It's a great example of how sports medicine and science are working together to help get people back to doing what they love. Thanks for listening to this Week 12 discussion.